What do people know about hypertension and its causes?
I think high blood pressure is an illness which usually strikes the elderly, and the causes might be eating too much of unhealthy food, mostly fats and caffeine. And yeah, that's what I think of it. But then even people at a young age can have it.
I understand high blood pressure is caused by taking lots of salt and too much fat.
How can people prevent getting high blood pressure?
Cut eating lots of salted things, less salt and less fat.
I'm really not sure what exactly it is. I think it's maybe when you're thinking too much and it causes the level of stress and your high blood pressure goes up.
So what do you think people should do to avoid it?
I think it's best if they avoid stressing, and obviously they try to find hobbies or something they can do to avoid stress, because to avoid stress you need to get something to keep you busy.
I just know like when your blood is circulating too much, like cool, like you can't stop, then like you have to drink those pills just to ease your system, like the blood pressure to go down.
What can people do to avoid having a high blood?
Eating fatty foods, like because there's stuff like this food that causes the high blood. But some foods like there's other certain foods. So you must just eat like like mixed fruits, nama veg, just not eating one thing each and every time.
High blood pressure, abantu abadala, more especially ogogo nomkhulu, and misibaqalile usually bayashiselwa, and then
sometimes they take some pills or bephuza amanzi noma bephuza bedle like a sweetie or something.
Right, so high blood pressure, medically known as hypertension, is a common condition in South Africa and is a major risk factor for heart attacks, stroke, kidney disease, and congestive heart failure. It affects approximately 6.3 million South Africans and is one of the leading causes of death in adults over the age of 50. 225 South Africans are killed by heart diseases every day, and 10 people suffer a stroke every hour. Now, globally, 13% of deaths are caused by high blood pressure. A sad fact, though, is that 80% of heart diseases and strokes can be prevented. Now, September is Heart Awareness Month, so today we discuss hypertension. And our guests today include a specialist physician, academic head and clinical head of the Division of Cardiology at Charlotte Maxeke Johannesburg Academic Hospital, Deputy Director of Non-Communicable Diseases from the National Department of Health, the Head of Clinical Policy Unit at Discovery Health, a Sales Manager from Patient Focus Africa, and a mother living with hypertension who will share her story with us about her living with hypertension and the story about her 30-year-old daughter who was living with hypertension. Now, be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead. Coming to you just after a short break. I'm Dr. Seloma Taung, and this is Health Talk.
Life can throw all sorts of surprises at you, often when you least expect it.
Sorry, Mom.
That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
Technology is used for both positive and negative.
Some governments block the internet in times of protest.
With this internet blackout, it's impossible for me to do it, so I have to travel to Douala.
This act is a true violation of the rights of citizens.
In Africa, people are always coming up with innovative ways to use technology to solve some of their problems.
The more interesting piece of technology is actually the artificial intelligence.
AI, it's utilizing data to make your life easier.
On Network, we'll give you Africa's technology and social media news.
Catch Network with Spumelele Zondi every Saturday at 8:30 p.m.
Hello and welcome to the Full View here on SABC News. It's great to have you with us.
You're not answering what I'm asking. I'm saying to you, none of the commitments were ever met. No, that's not true. None of them were ever met. That is not true. No. The Wenama Trust was not an act of the national government. Is somebody suggesting that the one who happens to have a white skin should be subject to expropriation without compensation? But again, I put it to you that has not been conclusively decided. That's what this whole process, which you are a part of, in making your submissions, will decide. We don't know what the final beast will look like. And until we do, all you're doing is fear-mongering. No.
In South Africa, more than 1 in 3 adults live with high blood pressure, and it is responsible for 1 in every 2 strokes and 2 in every 5 heart attacks. High blood pressure is known as a silent killer because there are rarely any symptoms or visible signs to warn that blood pressure is high. That is why more than 50% of people with high blood pressure are unaware of their condition.
The experience yami ukuthi ngeza nami ngazi ukuthi high blood yabaphatha abantu abancane because mina ngithole ngisese ncane ngibona abantu abadala kuyibo abahambayo bathi bane high blood but mangize esibhedlela ngangilimele and then ngadiagnose ukuthi hypertension but ngaloko ngilandelela ngisaba ngahamba treatment until ngize ngizolala esibhedlela mase ngilala esibhedlela and then mabona ukuthi okay very high blood yami iphezulu ngathaqala treatment yami since ngihamba treatment zonke izinto zihamba kahle.
I experienced high blood again ka 2016 anake le pregnant nexawe gore ke na le high blood until get check up for pregnancy ka thola gore high blood e high and then after pregnancy go clinic mampela gore maybe ke pregnancy etla fell after pregnancy azang etle stop until till now, and then they cannot treatment, cannot relax. Pilisi iwane white. Yana pilisi yan choose but once house in on a little tazil nalu champisa felalo mutusa nalu lebala. So now how lives nalu feel dizzy, little headache. So can checking experience
for sure secondly 12 years ke qadile pele mare ne ke sa tsebe gore ke na le yona ke be ke wa kanti ha ba ntse ba sa ha ba nthola ba diagnose gore ke na le yona kanti ke na le yona le diabetes. One time ke ntse ke tsamaya go treatment doctor wa ko mosebetsing e kutla ke na le so one time ke le week ke se ke le week ke le otherwise yang ka be ka wa ko tleliniking ke ga batla ba nromela ka tla mo bara ka dula 3 weeks ba thola re ke na le high blood le sukiri di high ka dula 3 weeks ba nkenya sekolo sa teng sa ba re ruta ka high blood ba re ruta le ka diabetes.
As the world commemorates Hypertension Day, it is important for communities to take ownership of their health by embracing healthy lifestyles and also go for regular checkups.
All right, so we're going to learn about all of these issues that you heard about just now about hypertension. And it's a great pleasure for me to introduce our special guest. First up is Dr. Adri Kok, who's a specialist physician and president of the Faculty of Consulting Physicians in South Africa. Welcome to Health Talk, Dr. Kok.
Thank you very much.
All right, and by the way, Dr. Kok has many other titles that she holds. She's the Congress Chair of the WCIM. We'll learn about that a bit later. And she's also President-elect of the International Society of Internal Medicine. All right. Then, of course, we have Dr. Ngova Tabeza, no stranger to this show, who is the Academic and Clinical Head Division of Cardiology at Charlotte Maxeke Johannesburg Academic Hospital. Welcome to Health Talk once again.
Thanks.
Right. And of course, last but not least, we have another special guest, Itumeleng Sihlare, who's Deputy Director for Non-Communicable Diseases from the National Department of Health. Welcome to Health Talk, sir.
Thank you, Dr. Mutaung. Good morning to you and good morning to the viewers at home.
All right. So perhaps let's start with you, Dr. Pok. Hypertension, some people call it high, and that sort of thing. What is it that we're talking about? What is hypertension?
I think the easiest way to understand is if you look at the blood vessels in our body, actually are like pipes. And what happens with hypertension, there's narrowing, and there's various factors in the body that affect this. So salt intake, as some of the viewers said before, is definitely a factor. As we get older, the blood vessels become stiffer. So that pressure causes a back pressure on the heart. And we then have to address all the factors that can affect those blood vessels from pushing up the blood pressure.
So as one person described it, the force of the flow of blood within these pipes is a little high. Now, are there any symptoms associated with high blood? Can anybody say that, you know what, I feel that my blood pressure is high?
Unfortunately not. So as many patients would experience, it's by accident that it's found. And you know, it is, sometimes people feel dizzy, there may be headaches, but most of the time we call it a silent killer because people don't know it's there. And that's why it's absolutely crucial for people to have their blood pressures checked.
Right.
And we look at other factors as well, which I'm sure we'll discuss in a moment.
Okay.
So I think that the level of blood pressure, of course, depends on the age of the patient. So you can't say young or old. It may even affect a young person. It may affect pregnant people.
Yeah. We might as well talk about it now. What's normal blood pressure?
So it does differ in different age groups. So previously we said, you know, there's one level for everybody, and that's changed recently. So 130/80 is sort of decided that would be an acceptable blood pressure. We know that in older people you can accept a slightly higher blood pressure. It's actually safer for them not to have too much of a low blood pressure because they can have a blackout from that. In young people and people with other diseases like diabetes, for example, high cholesterol, previous heart attack, we would sometimes then have the blood pressure at a lower level because that would give us a safer margin to prevent disease from progressing.
All right. Dr. Tabetsa, I mean, you know, people are wondering, this is Heart Health Month. We're talking now hypertension. How is that related to the heart?
Well, basically, the heart is in continuity with the blood vessels. So it's actually the force that generates the blood pressure that allows circulation.
Right.
So naturally, when one suffers from high blood pressure, it means the heart has to work extra hard in order to overcome that force to adequately perfuse your organs for the rest of the body.
So what can go wrong then in the heart?
So generally, the most common one that we see, you know, is an association of heart failure and hypertension, especially in our black population, and that's usually associated with long-standing undiagnosed hypertension. But hypertension as well also accelerates a condition called atherosclerosis, which is the buildup of plaque or dirt in the arteries, and that leads to heart attacks as well as can lead to complications to ischemic stroke, peripheral vascular disease. So really, to think about it simply, the heart and the blood vessels are all in a network, and when there's high pressure in that network, the heart suffers as well as the blood vessels suffer. So large blood vessels can complicate with stroke as well as heart attack, and then smaller blood vessels can also complicate, such as eye problems, where now you can't see well, as well as the kidney, which can be affected. And those are the common key target organ damages associated with uncontrolled hypertension.
Okay. Itimulang, he just mentioned uncontrolled hypertension, and I think it's a fact that there's many people walking around with high blood pressure and they don't know that they have high blood pressure. From a Department of Health perspective, are there programs, you know, out there to encourage people to, you know, get their blood pressures checked, or what are the programs that are there run by the Department of Health geared at this?
Okay. Thank you, Dr. Mutaung. Currently, as the department, we are conducting campaigns where we are encouraging our people to know their numbers. If you heard the previous speakers, they indicated that the main challenge is the undetected and uncontrolled high blood pressure. Then we are encouraging our people to go to the clinics, these campaigns, so that their blood pressure could be checked to detect as to whether is it high or is it normal, because that will assist in them maybe changing their life or trying to come up with necessary interventions to control it. And the other thing that we're also coming up with from the department is that, I think members of the public are aware of the regulations that we came up with, like for example the salt regulation,
Right.
because we know that salt also contributes towards hypertension, and we're also having like the bill that was like sent out for comments in May, the tobacco bill, which tobacco is also one of the risk factors for hypertension, and as a department we have that, and we also have like your sugar tax, which is known as
We're going to come back to that, because I think you're now talking really about prevention and what needs to be done around prevention.
Right.
Let's just get back to the issue of high blood pressure. Oftentimes we're told it doesn't happen on its own. It's normally associated with other conditions. It just doesn't exist on its own. Your comment on that?
So one of the commonest features, I always say to patients, can you see your toes past your stomach? If you can't, you're in trouble. So obesity is one of our big challenges in South Africa, and especially abdominal obesity. Now, with the abdomen, there's different hormones that are released that actually worsen blood pressure. So obesity is an important factor. Itumeleng had said the smoking is an important factor. Diabetes is a scourge that's affecting our community, especially in Africa. Many people are still undiagnosed. High cholesterol levels. So there are various factors, again, that cause the buildup of the dirt or the plaque in the blood vessels that accelerate that hardening of the arteries, which then worsen the whole condition.
Okay. So often people talk about prognosis. They say, so what's the normal course of events if somebody gets, diagnosed with hypertension? Is it a diagnosis for life? Does it mean that somebody has to be on medication for the rest of his or her life? Is it any different if somebody has hypertension plus diabetes?
Yes, so basically the natural history of the disease is if uncontrolled and undiagnosed, you basically complicate with target organ damage. So the first time you'll present to a health facility is when now you've either had a stroke, a heart attack, or have heart failure or kidney failure. And then we will tell you that the cause for this is most likely your hypertension, which is now a new diagnosis that's been there for a very long time, right? So if one treats that, however, the prognosis is excellent. One can prevent the condition from worsening. You can prevent target organ damage. So the benefit of doing that really is remarkable. And that's what I think the message we're trying to get out there, that people should know their numbers. They should test and check. You don't have to be ill in order for you to go and test. As long as you're an adult, and as Dr. Koch has mentioned, you have the other culprits, high cholesterol, obesity, diabetes, especially those individuals. You lead a sedentary lifestyle, you should definitely go check.
All right, we're going to be saying these things over and over again because they're very, very, very important. Okay, time for a quick break. When we come back, we now try and understand this whole notion of who's at risk of developing hypertension. Please stay with us.
They've wasted our time. They've made our members to go on strike. They've made the public to suffer for nothing.
Andikwazi ukutya i-treatment ngendlela ngenxa into yoba imali ayikho. Fumene 600 xa ndiphinda futhi ndidrowa ayiphumi ayikho kwakwi-account.
What we are experiencing now is due to the number of people accessing the system at the same time. So if they can just be patient for 3 to 4 days.
As democracy matures, we get into discussing very, very sensitive issues.
I think that there's a lot of people that are applauding it. I'm sure it's going to be appealed.
It is the beginning of a long journey of South Africa fighting racism.
That sticky label of being a white party, so to speak,
doesn't seem to want to go away.
So the competition actually helps, and it brings out winning in total.
Stay tuned to Media Monitor every Sunday from 9 a.m.
Welcome back. We're talking hypertension with our special guest, Dr. Adri Kok, specialist physician and president of the Faculty of Consulting Physicians of South Africa. And we also have Itumeleng Setlhare, deputy director, non-communicable diseases from the National Department of Health. And we're now joined by a special guest, Joyce Masuku. Joyce Masuku is going to share her story with us about, her living with hypertension and her daughter, 30-year-old daughter, who also had hypertension. Welcome to Health Talk, Joyce.
Thank you.
All right, I'm going to come back to you now. Let's start with you, Dr. Kok. We introduced this by saying who is at risk of developing high blood pressure.
Yeah.
So, this condition, who is affected?
I think, we have the normal picture of this overweight person who might be a smoker, high cholesterol and so on. But it's equally important that many of our young people suffer from high blood pressure. And so I think the message is know your numbers. Go and check it out. You don't know it, you can't feel it. It's really important to actually have a measurement done. There are very good measurements available at your doctor, at your pharmacy. You can even have a home measurement machine to check your blood pressure. So you can't assume that it's not going to affect you, and especially if there's a family history.
In fact, that clip that we played earlier, I mean, it was clear that people felt that, or at least in terms of what they knew, this is a condition that affects the elderly. So what you're saying is, no, even the young people can be affected.
Absolutely. The one young lady that was pregnant, that had it in pregnancy, and unfortunately it is important, that the pregnancy, a person who wants to fall pregnant should make sure that they're healthy before they fall pregnant and during the pregnancy to make sure that they're monitored. Young men, doesn't mean if you're young that this can't affect you. Especially if there's a family history, it's important to be very careful.
Okay. We'll come back to what other causes, and we're talking about risk factors. Basically, what you're saying is if there's a family history, if anybody in your family has high blood pressure, you're also at risk of developing high blood pressure.
That's right.
We'll come back to you. Let's speak to Joyce. Met Joyce. Now, tell us your story. When were you diagnosed with hypertension? You can respond in Zulu, that's fine. We'll translate later.
Ukuthi ngine high blood ngithole uma ngabe qala ukugula amantombazane wami oyi2 lo omunye wathola ukuthi une high blood ena 21 mayizoyothola ifirst born yakhe eBar.
Okay.
Bazi bamtetisa nge7 months.
When did you how old were you when you realized you had high blood pressure?
It was 2011.
Oh, in 2011.
2011.
Okay. All right. So you actually had 2 daughters with high blood pressure.
No, the other one she got cancer.
Oh.
The one she got a high blood.
Okay.
But he's passed away together all.
With the one with a high blood pressure.
Ushone this year. June.
But
the problem with high blood ngoba bathole ngo2013 ukuthi ama kidney wakhe aseshiswe high blood. High blood yakhe iphezulu kakhulu. It's about 200 and something, 190.
Yeah. For the sake of our other viewers, what she's saying is that, her daughter unfortunately passed on as a result of complications of high blood pressure. The daughter developed kidney failure in the end, and as a result, she unfortunately succumbed to the illness. When again, Mama, une high blood angithi?
Yeah.
So unemnyaka uthatha amaphilisi.
Ngiyawathatha ngibuye ngistophe ngoba mangithi ngiye clinic bangitshela ukuthi right.
Yeah.
Angamise ngamaphilisi. Ngibuye futhi ngibe ne stress bese iyakhuphuka futhi ngibuye ngiwathatha amaphilisi.
Interesting what she's saying. What she's saying is she's on treatment, and sometimes she stops treatment not because she wants to stop treatment, but she's told to stop treatment because her blood pressure is now normalized, and the minute that it starts again, she restarts treatment. And I'd like a comment from Dr. Kok on that, because I'm not so sure that's correct.
Absolutely disastrous. Once your blood pressure is controlled, you continue the medication because, again, it doesn't cure the hypertension. So if you diagnose, like, for example, with an infection, you can treat the infection, it goes away, it's gone. High blood pressure stays, so it's for the rest of your life. I always say to my patients, one day after you die in heaven, you tell them, I've got to take my tablets because doctor said I must take my tablets.
Right.
So it should never be, if it's controlled on treatment, fantastic, but you have to continue with treatment. You should never interrupt treatment. It should be ongoing.
Okay. Maybe let's get a comment from you, Itumele. I mean, what she's described is what she gets told at the clinic. I guess it's two levels. Here it's about education that's given to ordinary members of the public and, I suppose, the staff at the clinics. What type of education is given out there? What information is shared with people with hypertension? Or anybody else for that matter?
Yeah, no, that was quite interesting. But as the department, we have clinical guidelines where professionals are being taught and expected to follow the guidelines. And in our guidelines, there is nothing like where it is stated that when you are controlled, then the treatment has to be stopped. I mean, it was quite interesting to note that, and that is not right, like the doctor has just indicated. Right. Hypertension is a chronic disease. You need to take your medication for the rest of your life. Because if you don't take your medication, obviously, the medication is there to control the blood pressure. The minute you stop the medication, then the control, it's like you are removing the control. Then the blood pressure is going to shoot up again.
Ma'am Joyce, I'm sure you've been listening. Anybody else you must stop your treatment for a while. I mustn't. So the advice basically is that should anybody ever say to her that she must stop her treatment, she should say, the top doctors that were on this television show said I should not do that. Let's come back to you, Dr. Cook. Now, we mentioned earlier there's secondary issues. Or maybe you can advise us on what the difference is between primary and secondary hypertension. What is it that we're talking about when you talk about it?
The vast majority of patients have what we call primary, or where we don't know what the exact cause is. So there are different factors that we've discussed already. Secondary hypertension is if there's a specifically a hormonal problem that causes it. It's a very small percentage of people. So we usually, in a young person, especially if they present with uncontrolled hypertension, we would investigate that. And this could be hormonal problems secreted by the adrenal gland, which is a little gland above the kidney. It could be conditions that affect different hormone systems in the body. Right. But it's a small percentage. Very few. Yeah. Usually in young people, we would investigate that.
I think the one area I'd like us to focus on a little bit, we mentioned obesity.
Yeah.
And then lifestyle factors associated with that. Let's say this is a young fellow who's obese, but does not yet have hypertension and perhaps is at risk of developing hypertension because of the family history.
Yes.
Social factors, environmental factors that may trigger development of hypertension in that sort of person.
I think most important is activity. Yeah. If you can exercise, and we want the kind of exercise where you actually get your heart rate up. So it doesn't help to sit on a bicycle and once an hour your legs turn once. You know, you've got to actually get your heart rate up. So we say 4 to 5 times a week, at least 30 minutes of exercise with cardiovascular exercise where you actually build up a sweat. If you look at alcohol intake, a little bit not bad, but obviously any excess of alcohol, again, not a good idea. Many of the patients mentioned, or many of the people interviewed mentioned salt intake. And with salt restriction and exercise and weight loss, you can actually stay off medication in a significant number of patients. So I think those are the lifestyle factors. I think a good diet is the one that's really stood the test of time is the Mediterranean diet. Vegetables, some protein, not too much fat, fruit, and a limited intake of salt. I think those are important factors.
We're going to continue that story in the next segment. But we were just listening to Ma'am Joyce, talking, I suppose, about the impact that the condition has in an individual. But what about the impact on the healthcare systems in general?
Yeah, we are having serious problems as far as the non-communicable diseases are concerned. Because as is right now, or as government, we don't have enough resources to do everything that we would like to do. And if we can't increase the burden or increase the size of the problem, then we're not going to have enough resources to attend to that problem. Then it's about time that maybe we educate our people to start taking care of their health, Because as is right now, non-communicable disease is like a time bomb, just waiting to explode. Because as is right now, we're not doing enough, we're not preventing it, we're not controlling it, and that is a problem.
Yeah, all right. Well, Ma'am Joyce.
Yeah.
I'd like to thank you so much for being brave enough to come and share your story with us. Okay. Perhaps you want to have a last word or two, very quickly, to others that are watching this program.
Okay. Mina into engicedayo lapha emsebenzini bayangisupporta kakhulu ngokungichecka kakhulu mari.
Right.
Bayangifaka ne 24 hours kakhulu mangi ku transport iyakhuphuka. Mangilele iyakhuphuka futhi kodwa mangisendlini nje ngihleli iba right iba normal.
So basically you're very happy that at least your employer supports you in the management of hypertension and you get monitored 24 hours.
Yes.
Well, thank you so much for sharing your story with us. Okay. That was Joyce Masuku, living with hypertension, just sharing obviously her story with us. And time for a quick break. When we come back, we now start talking prevention, or we continue discussion. Please stay with us.
We probe.
His bone crushed on 3 places. So he said, well, we're going to have to amputate. And I was like, what?
We confront.
This young girl was abducted when she was 16. She was sold off by her older sister. Now, in grade 11, she has 3 children.
And we expose. Catch Special Assignment every Sunday at 9:30 right here on SABC News Channel.
1,000 angikhona ukuhlala 2 weeks ngayo. I spend 60 rand, return 820, and I work every day 5 days.
These people cannot continue to hold those offices of government, and also we are calling for them to be removed.
Due to your negligence, many people have died. You must go to jail for murder.
If you want our vote next year, make sure that you do what you are supposed to do.
The Cape Flats is under siege by the gangsters, by the drug dealers.
The community here say at this point in time they have had enough.
The end of the day, what is happening? The police do nothing. The doctors get lost. We are sick and tired of this.
We want the government to take note of us.
Talk to us about this Imbiza.
It's a national call for black people to come and have a conversation about the black condition. We have realized that after all that suffering, black people are still going through economic frustration. We also believe that heritage should be there to bring black and white together. We're not against the idea of rainbowism.
Welcome back, and thank you so much for staying with us. If you just joined us, we're talking hypertension, and we have our special guest, Dr. Ngoba Tabedze, Academic and Clinical Head, Division of Cardiology at Charlotte Maxeke Johannesburg Academic Hospital. And we're now joined by 2 other special guests, Dr. Noluthando Namatsorani, who's head of the Clinical Health Policy at Discovery Health. Welcome to Health Talk, Dr.
Thank you.
Namatsula.
Thank you so much.
All right. And of course, we also have Dirk van der Westhuizen, who's a sales manager at a company called Patient Focus Africa. Welcome to Health Talk, Dirk.
Thank you very much.
All right. Let's start with you, Dr. Tsabetse. We're talking here prevention strategies, and we're going to be talking about screening just now. And I think we've been throwing a bit of, this and that about prevention in general. But just general principles of prevention, if you like.
I think, as previously mentioned by the previous guest that you had, it starts first of all with knowing, am I hypertensive or not, right? And if you have a family history of hypertension, one of the things that one can do, you can look at those that are modifiable and those that are non-modifiable.
Right.
Those that are modifiable, for example, you can stop smoking if you are smoking. If you're living a sedentary lifestyle, you can start exercising. And it doesn't have to be anything fancy like joining an expensive gym. It could simply mean walking 4 or 5 times a week, at least for 30 minutes, and just getting your heart rate up.
Right.
Choosing healthy lifestyle choices. So the principles regarding food, which is generally a very common question that we get, is keep it to natural foods, eat healthy, and keep it raw. Avoid processed foods. Preserved foods, so those that come in tins, for example, as well as things that are processed with additives, preservatives that last for long.
Okay.
And those are really the anchors, I'd say, in terms of preventing. So know your risks and then prevent.
So perhaps we should be a little careful, and it's my fault with the way that I phrased the question. We may not strictly be talking about prevention, but we can talk about delaying development of hypertension in those that are at risk. Okay, let's take a call. Agnes on the line from Gauteng. Agnes, welcome to Health Talk.
Thank you.
Yes, Agnes, your question or comment?
Okay, a question I'm 2014 I got diagnosed with me BP. Then I had a treatment, asthma, and then a clinic banjol with BP, I high to
Right.
Then the treatment. So the treatment every day explaining so
okay. All right. Thank you very much, Agnes. For the sake of our other viewers, she was diagnosed with hypertension and happens to also have asthma in 2014. The problem that she's having is that every time she takes her medication in the morning, every morning, essentially, she vomits all the time. Let's give it to Dr. Tsabetse. What can she do?
Yeah, I think basically what Agnes needs to do is report this to her treating physicians. Probably she may be having a side effect or an adverse event from the medication that she's taking.
Right.
There are many antihypertensive medications that are available, different brands, different mechanisms of action, and they can definitely find an alternative that would be suitable for her, that will not cause her nausea.
All right.
Yeah.
Dr. Namatsula, let's talk about how hypertension affects medical schemes. I mean, you are in one of the largest medical schemes in the country, and surely you have lots and lots of people with hypertension. Just tell us how you tackle the whole question of hypertension in the scheme in general.
Yeah. So I think if you look at hypertension, I mean, we've had the stats around, global and local stats. If I look at Discovery, for example, and we look at our chronic prevalence, hypertension is at the top, right at the top, by prevalence and by incidence, meaning that the cases that we have in volume and also the new cases that are diagnosed every year. So we are seeing an increased, incidence of hypertension. And obviously that contributes to the costs that the scheme has to pay for. What is important, though, is that if you look at hypertension as a single disease, it is potentially low cost because of the medications that are used. I mean, if a patient is on a diuretic, it is a cheap drug to use. But because of the high volume, so even though we say relatively low cost, but because of the volumes, it becomes more expensive. But if you look at the complications related to hypertension, if we go to chronic renal disease, where patients go into dialysis, when we look at patients with ischemic heart disease, patients who get heart attacks, so the cardiovascular complications, renal complications, stroke, all those complications are much more expensive than the primary condition that the patient suffers from.
So it really hits the
the medical schemes quite high. So if you look at it, I mean, we've got benefits that are there for patients to actually screen. So we encourage our members to actually go and screen because prevention is better than cure.
Sure.
And
talk about screening. Let's bring in Dirk here. Now, we often say to people, go out there, know your numbers. You know, just tell us a little bit about what is it that you have in your hand, and how you teach people the correct way of measuring a blood pressure.
I think the most important part is probably getting a blood pressure monitor that's accredited, so you know the actual results that you'll get is accurate, and also the blood pressure monitor that can be calibrated. So I've got a MicroLife blood pressure monitor here. It also will screen for AFib, so it does 3 readings. It takes the average of the 3 readings and will tell you if an AFib is present.
So what is AFib?
Atrial fibrillation.
Right.
So if you also take your cuff into account, the cuff size is very important. The MicroLife range has 5 different cuff sizes. So from a small cuff to an extra large cuff, which gives you 52 centimeters.
So who should use which cuff? And how should they apply it? Is there a way that people should apply this cuff?
For patient monitors, it's actually very easy. So you can do this at home. It's quite easy to put on. You would put it on your arm. It gives you it shows you the mark for the brachial. So you would easily put it on your arm. You don't need a second person to put it on for you. And it's got a 1-button operation. It's plugging the cuff in, the connector in, sitting back and relax. Also, your legs shouldn't be crossed. You shouldn't have a full bladder. Have back support. Your cuff should be 2 fingers from the fold of the arm, and then just relaxing your arm and pressing the button and taking a reading. It's as simple as that.
Okay, all right. Before we run out of time, we're talking prevention, Dr. Tsobetse, and I believe that you're partnering with the Department of Health on some activity to get people to be active. Just tell us a little bit about that.
Yeah, so the Division of Cardiology, I mean, we're at the forefront where we see a lot of the complications of cardiovascular diseases, patients presenting with heart attacks, heart failure, etc. So we felt that we ought to do something. We know that this is a problem, and we as I said, we're in the front line. So we decided to use World Heart Day Fun Run Walk as a vehicle to basically increase awareness. And so what we're targeting are people who are sedentary, who have hypertension, who have a family history, who are diabetic or have a family history, who are not active, who know they're slightly overweight, maybe they're smoking, and we are encouraging them to come participate with us on Sunday morning, this coming Sunday morning at 7 o'clock at WITS East Campus at the Bazoli Sports Complex. What's important is we will also be offering free screening. So the public can also come and get their blood pressure checked, their height, their weight, and a random glucose test done for them, which is a big bonus. And what we really want to do is make cardiovascular diseases awareness a priority, so that people suddenly are aware that this is a killer. It's emerging in our communities. It's a pandemic. In fact, just to give you some numbers, last year a stats essay came out saying that non-communicable diseases are now the #1 cause of morbidity and mortality in our country. It's no longer infectious diseases. And we are going to see that number rising exponentially. And so this is an effort from our side as those in the forefront to say, let's do something about it.
Is it a once-off event, or are you going to be doing that? This
is going to be an annual event. So every year in September on World Heart Day, whichever that weekend it lands on, we're going to host this event. Anyone is free to come. We're offering a 5K fun run walk. 8K, we're going to have water points. It's a JOC approved event, as well as approved by the Central Gauteng Athletics Association. So it's accredited as well. People can grab vitality points for the event. And
of course. All right, let's take Anonymous on the line from Gauteng. Anonymous, welcome, and thank you so much for your patience. Anonymous, are you there? Anonymous, we seem to have a problem with Anonymous. Okay. All right, we're about to go on a quick break, and I'd like to find out from you, but we'll do that after the break, to just find out exactly what programs you have, as Discovery Health, along the lines of prevention and promoting healthy lifestyles. That after the break. Please stay with us.
They've wasted our time. They've made our members to go on strike. They've made the public to suffer for nothing.
Andikwazi ukutya i-treatment ngendlela ngenxa into yoba imali ayikho. Fumene i-600 xa ndiphinda futhi ndidrowa ayiphumi ayikho kwakwi-account.
What we are experiencing now is due to the number of people accessing the system at the same time. So if they can just be patient for 3 to 4 days.
Welcome back, and thank you once again for staying with us. We're talking hypertension with our guests. We just had Dr. Ngoba Tabedze, who's a cardiologist from Charlotte Maxeke Hospital, but now we have Dr. Adri Kok. We also have Dr. Nolthando Nematsorane, and of course Itumeleng Sihlare from the Department of Health. Let's stay with you, Dr. Nematsorane. Before the break, I asked you to just perhaps share with us those activities that you have or programs that you have within Discovery that are aimed at promoting healthy lifestyles, as we heard.
Okay. So firstly, we've got Discovery Health Medical Scheme that offers benefits for screening. So regardless of whether you are a Vitality member or not, you'll have access to screening, and once you are screened, then you are transitioned to existing benefits where then you have got a basket of, of items that are used to treat your condition. So your consults, your medication, and also blood tests that relate to the monitoring and treatment of hypertension. Then we also have, obviously as a standalone company, Discovery Vitality, which is our wellness company. So Vitality encourages healthy lifestyle in terms of nutrition, physical activity, and obviously the screening component that says once you screen, so know your numbers, which is what we've been talking about, know your health, and then once you have known your health, improve your health. So as you improve your health, you get rewarded with points. I think most people know Vitality as a rewards program, but it is actually a wellness program that encourages people to live healthier lifestyles.
Not aimed at getting free flights.
No. You must know your numbers, improve your health. You only get the rewards after you've done the right thing.
All right.
So I think that is the biggest wellness program that is available. I mean, Vitality is also a global company now where we are really driving wellness across the globe to say people must know their numbers, specifically addressing the increasing burden of disease related to NCDs, non-communicable diseases.
Dr. Kok, I'd like you to just touch on just the treatment principles. I mean, there's a variety of treatments, I would imagine. Just around the principles of treatment. But before that, let's take Elizabeth on the line. Elizabeth, welcome to Health Talk.
Hello.
Yes, Elizabeth, your question or comment, please.
My question is, what happened when you have not taken your blood pressure pills in the morning and then you remembered it in the afternoon? Can you take it or you must wait for tomorrow?
Excellent question. Thank you so much for that question. And I'm sure Dr. Kok will address it when you talk principles of treatment, yeah?
I think the majority of people need 2 to 3 medications to control the blood pressure. So very seldom do we get away with one. So I think we try to make it less complex for patients. So the combination agents where you have 2 or 3 in one tablet make it a lot less complicated for people to take their tablets. If it's too complex, people forget. And I think it's always one dose that you've missed. It's safer then to leave it for a day, but only for a day, not longer than that. Because it's important that you then remember the next morning. So sometimes many people have cell phones. They can put a reminder on the phone if they forget. They have these Monday, Tuesday, Wednesday partitions that they can get from a pharmacy to help them remember. So if the tablet is in there, they know they've taken it. If it's empty, if it's still there, they know they haven't taken it. And just to try and get yourself into almost a routine to remember to take your tablets correctly.
I think it's important for us to go back to that issue of monitoring of treatment. One of our crew just asked a question to say, his mother is diagnosed with hypertension, and oftentimes when, they get to the clinic, she gets told, stop treatment because it's too low, and at some other time, okay, restart now because you're feeling a bit dizzy because it's now high.
Yeah.
Just the principle around that. Please.
I think importantly, people can have side effects. Some medications may affect you negatively.
Yeah.
It's important that you discuss that with whoever is treating you, whether it be at a clinic or a general practitioner or a specialist. And it's important if you do have side effects, don't just stop your tablets. Rather go and have a look and see what's causing the problem.
Yeah.
It's also important that we don't just go on one reading for blood pressure. You want to see what the pattern of the blood pressure is, and that's why the home monitoring gives us a big advantage.
Okay.
And these are really affordable ways to monitor yourself.
Before I let you go, Dr. Cook, I introduced you earlier as the Congress chair of this World Council on Internal Medicine. Please tell us about what this is about.
We have the opportunity for the first time in Africa to host this World Congress. We have 82 countries attending in October. It will be at the Cape Town ICC. And we have all aspects of internal medicine that will be discussed. We have an excellent panel of speakers. And we've tried to really look at all aspects of internal medicine. So hypertension obviously being part of it, heart disease, diabetes, asthma. So anything that affects the internal organs will be discussed.
So people watching this program will wonder, so how do the ordinary members of the public benefit for something like this?
Well, if we don't train our doctors and our specialists, I always say that I want to be a stupid doctor. So you have to keep on understanding what the academics have given us, what new research shows. Patterns change, we understand better medications, we have a better way of doing things. New medications are developed for a reason, because sometimes there are gaps in treatment.
All right.
So this
Before
gives
we
us
run out
that
of time,
opportunity.
Let's take Ishmael on the line from Cape Town. Ishmael, welcome. Ishmael, are you there?
Hello?
Yes, Ishmael?
Yes, I'm on about 3 tablets, okay?
Yes.
So I take it in the morning. But my wife is saying that I sort of heat up at night during the night. A doctor has also taken away a beta block that he gave me as well with these 3.
Yeah.
I want to know, is there something wrong with the medication or what's going on?
Thank you very much. Let's give a
So-
quick response from Dr. Cook. Yeah.
Just quickly, some medications don't have a full 24-hour effect. So sometimes we do use some in the morning, some at night. A water tablet, which we call a water tablet, is actually reducing salt in the body. They should be taken in the morning, otherwise you're going to be up all night. So some medications have a better 24-hour cover, and so you have to be sure if your blood pressure is going up in the evening, it may be that your treatment isn't adequately controlling the blood pressure. And you should review and see that you get onto an agent that gives you 24-hour cover.
Okay. We're almost running out of time, and I'd like a comment from you, just in terms of treatment of these chronic conditions at the public institutions.
Yeah, thanks, Dr. Mutaung. Yeah, like I said earlier on, we are trying to train our professionals at the cutting edge of things so that they can do the right things, And we are trying to we're also ensuring that the necessary medication is there so that the patients can be treated. And there is also a way of notifying the department if maybe there is a shortage of specific medicines. Then we are encouraging our people to take a note of such initiatives so that if maybe they don't get their medications at the clinics, they can always, inform the department or notify the department to say, hey, at such and such a clinic, there is no such and such a medication is not available. All right. Thank you so much.
And unfortunately, that's all we're going to have time for today. I want to thank all of our guests, and unfortunately, we don't have time to go through all of the other issues that we would like to have, touched on. But thank you so much for your contribution. And for you folk for watching, thank you so much for staying with us. And thank you so much for all the calls and all the tweets that you normally send us. And we're back on your screens next week, same time, same place. And until then, please do take care.